We are back on Morning Line. Thanks for joining us. Dr. Calvin Smith is with us from Meharry. If you have a question or a comment this morning wondering about the COVID vaccines and what's in the works, now's the time where you can start getting it. Coming along, by the way, Dr. Smith, just as we approach the time of year where we're getting flu vaccines too. Will there be people getting both?
Yeah, people will get both. Right now, what I've been recommending for my patients is if they're getting the COVID vaccination in particular, I'm telling them to kind of wait in an abundance of caution.
Okay, don't get them boom, boom, same day.
I wouldn't recommend it just because, you know, again, the science would support that people probably can go ahead and do them back to back because we do a series, like if you think about what we do with kids get series of shots.
That's right.
So we probably could, but in an abundance of caution, I'm telling them to wait about a week to 10 days.
Week to 10. That's what I'll do. Let's go to Barbara. Barbara, good morning. Hi, Barbara.
Hi.
Hey, go ahead, ma'am.
Yes, I'm high risk. I've had 2 Pfizer shots, and I'm fixing to get my booster shot, and I've had my flu shot.
Great.
And I was wondering, I heard something about high-risk people should get a full dose instead of a booster shot. What's the difference in that?
Okay.
So for me and what I've read, the full dose just kind of gives you that extra boost of memory cells. Mm-hmm. And, you know, again, it depends on the source that you read. The biggest thing is to go ahead and get a booster. You know, a lot of the infectious, and this is where I have to step back and say I'm not an infectious disease expert. Okay. So I can't tell you for certain that there isn't much of a difference between the full dose and the half dose. But if they are recommending that, if that's what they have studied and recommended, I would say that that's probably the prudent thing to do, especially if you're high risk. Again, there's no risk in getting a higher dose of the vaccine anyway.
Okay, that's what I'm thinking is that I think she said she had Pfizer. Yeah. And Pfizer is giving a full dose as the booster. So that's automatically what you'll get, ma'am. You will get the full dose. Moderna is the one they're thinking half dose. And I think if what you're saying is accurate, and I believe it is, I'm wondering if they're doing this just because, look, if we can get by and a half dose is just as good, that allows us to create more doses. And, you know, we want to make sure the supply is there, maybe. I'm just wondering why else would they say, well, let's just go for half instead of full? Well, like, if we go half, that doubles the number of doses we have available to give to more people if they need it.
That's very much along the lines of what I think they're thinking. Yeah. Because again, if we can give you a lower dose, again, we can give out more doses of it, and from a financial standpoint, from the company standpoint, which again I want to stress, because a lot of people when they hear doctor talk think that I'm in the pocket of big pharma. Yeah. I could care less. I don't get any money.
You're not getting paid. Right.
My money comes from Meharry Medical College and teaching. I don't get a penny for the patient care that I deliver, nor do I get a penny from any pharmaceutical companies. I don't go to drug rep dinners. The last drug rep dinner I went to as a resident. Okay. So like I'm not influenced by these companies. As a matter of fact, I'm almost as skeptical as the general public is. Mm-hmm. I just read a lot more in terms of journals and not from YouTube videos.
Okay, I'm glad you said that. I mean, a lot of people do. They think it's a money-making venture or something along those lines. And by the way, when people do show up for these boosters now, is it going to cost them anything?
No, it's free. Okay. It's free.
See, that's the thing. It's free. And to be real clear, too, early on when the vaccine first became available, it was very important when there was a limited supply at first that, you know, those who needed it most get it first. You know, I mean, I wanted it as quick as I could, but I wasn't going to do anything to jump ahead to someone else that really needed it. I waited my turn. There's not as much of a supply issue this time around.
Not at all.
There's plenty for everyone if you want it.
Plenty to go around, and this is a moment of free advertising for Meharry at the Henry Moses Alumni Hall. Okay.
That's right there on campus?
Right there on campus, right between the dental school and the School of Medicine. Okay. No wait, and you can get your booster there.
Just go on in there.
Just go on in there.
Do you need to bring your existing card? Like, for instance, I'll probably go there because of this. I like that. It's downtown, not far from me. I didn't get my first ones there. Yeah. So I can go. Do I have to bring my card with me?
It's helpful to bring your card.
I have a photo of it, but
if you have a photo, that helps. The records are also there. If you've gotten your booster from anywhere, they've all put it into a database as far as, you know, who's gotten the vaccine and who hasn't. Okay. So for me, I'll tell you, I didn't have my card when I found out that the booster was available. Okay. I went ahead because, again, I was taking care of patients. I said, let me do the thing that's the best thing for the patients that I'm taking care of. Went ahead and got my booster. They wrote me out a new card. So it's not if that's a limiting factor for you, it shouldn't be. Go ahead and go to whatever, and also the vaccine site on 28th Avenue across the street from Lentz also is giving the vaccine, and from what I've seen, because I've gone over there, I'll be over there a little bit later today to visit the people over at the public health department. The lines are reasonable. It's not like in the early days when people were waiting hours to get the test. You know, it's not like that anymore.
You know, you mentioned tests. I went the other day, and they're hard to find, but I bought some of those at-home tests. I forget the brand I bought, and I remember asking the pharmacist, can you tell me about this one? She goes, there's several out there. I've heard some maybe are a little more effective than others. She goes, this one that you've got here, what I've heard is that if you get back a positive test on it, it's pretty much dead on. She says, I've also heard there have been cases where we think maybe they got false negatives. Now, so that's kind of like, but she goes, in general, it's pretty good. You know, what do you think about having that? I thought it would be handy to have one if I'm just feeling kind of achy or whatever and thinking I'm along those lines to test it. And if it comes back positive, then I'll go get the real deal. But usually it still takes 2 or 3 days to get that result back if you go somewhere.
So
what's your take on the at-home ones?
So the at-home ones, actually, the scenario you pointed out is the exact scenario I would tell people to do. If you feel ill, taking it home. If you can afford to get the at-home test, take the at-home test. If it's positive, that's a pretty good indicator. Again, the false negative rate is what you're worried about. So, you know, if it's positive, it gives you a pretty good idea that you are really sick with coronavirus. And so, with that being said, the other instance that I would say for the at-home is like if you're traveling and you're about to take a trip or something like that, you want to make sure that you're safe for other people on the plane, other people in the airport, things like that, to use at home there. But the at home is pretty reliable in terms of positive test results.
So just so you know, I bought mine at it was Kroger, and it's a package and it has 2 tests in there. It was $16, and I've just got it there. And that's a great example. If I were to go. Last time I went and got independently tested before I visited my folks in Boise, Idaho. They're elderly, and I wanted to make sure. In fact, I got 2 tests, and they were fine. You know, but that's a way to go.
So we're doing weekly tests at Meharry. But if I were, you know, I'm doing some traveling next week. My sister just had a baby. I got a new nephew. So I want to visit them. And, you know, I want to be extra safe with little Malcolm. And so I want to make sure that I'm, you know, not going to be transmitting the virus to my closest family members. I'm going to definitely test myself before I go. You know, and so I have the, you know, I'm lucky that you know, and I don't see it that way all the time, that I have to go in weekly and get a test done. But I'm lucky that that's available to us, and I want people to really understand and consider that all of these things are free, or at least we're not paying for them right now. We'll probably end up paying for them down the road, but they are available to you without cost right now. And you know, it's because of the abundant concern about it, you know, and so I want people to understand that everybody who is important, all of the heads of every single media outlet out here, I'm not going to name any particular names, but every person in every media outlet who holds a big stake is vaccinated. Every person who has been in charge of a large governing body, either of the country or of a state, vaccinated. You know, and so there's no grand conspiracy here. There's no, you know, the billionaires have no stake. They already have you if you have a cell phone. You know what I mean?
If you're talking about being tracked.
They already have you if you have Alexa at home. They already have you if you drive a car. You know what I mean? GPS is everywhere. So, like, the concerns about there's no technology involving putting microchips in anybody. This is hogwash. And you know, if this is a concern for you, then you know, you may want to just go completely off the grid, and you'll be safe from the virus there too.
Off the grid, a desert island somewhere. We'll take a break on that note. When we come back, we'll take a few more phone calls if you'd like. It's our final segment with Dr. Calvin Smith at Meharry. He's fantastic, and he explains things in a way that even I can understand them. So if you have another burning question about how things are shaking out here with COVID and the vaccines and boosters, join us. We'll get you in right after this. Stay with us.